Bismillahirrahmanirrahim. Assalamu alaikum. A 48-year-old woman come to the office due to clear watery vaginal discharge for the past 2 weeks following radical abdominal hysterectomy for cervical cancer. The discharge occur during the day and at night, and as a result, the patient has been using a few pads a day. She has no vaginal bleeding. Cervical cancer was diagnosed on cold knife cone and cervical biopsy, which was performed for evaluation of grade 3 cervical intraepithelial neoplasia on colposcopic biopsy. The patient also have type 2 diabetes mellitus controlled with oral medication. She does not drink alcohol or caffeinated beverages. Vital signs are normal. The patient abdomen is soft and non-tender with a well-healed laparotomy incision. Genitourinary examination show most vaginal mucosa and a pool of fluid in the vaginal canal. The vaginal apex appear normal, with urine lysis results are as follows: specific gravity 104, blood trace glucose negative, leukocyte is trace positive, nitrate positive, bacteria moderate, and white blood cell 20 to 30 cast are negative. Which of the following is the most likely cause of this patient current symptom? So first of all, this patient is 48-year-old woman. She came to the office due to watery vaginal discharge for 2 weeks following radical abdominal hysterectomy for cervical cancer. Genitourinary examination show moist vaginal mucosa and a pool of fluid in the vaginal canal. On urine RE, which show that the blood is trace, leukocyte is trace positive, nitrate positive, and bacteria moderate. WBC are 20 to 30. So based on these hints, what is the diagnosis of this question? The most likely cause of this patient current symptom is vesicovaginal fistula. Vesicovaginal fistula due to recent surgery. So why the choice H is the correct one, vesicovaginal fistula? Because this patient continuous painless urine leakage is most likely due to vesicovaginal fistula. After her recent pelvic surgery, the diagnosis is made clinically by visualization of urine leaking into the vagina. Sometimes a small area of granulation tissue or a hole may be seen. Dye test or cystourethropy may be performed to identify a small fistula that is difficult to detect on visual inspection. Cystitis may be a complication of urine, and urine lysis may indicate infection as seen in this patient. Bladder catheterization is the immediate post-operative period allows a small fistula to heal. Otherwise, surgical correction is indicated. Come to the incorrect one. Bacterial vaginosis. So bacterial vaginosis present with white, gray, or tan vaginal discharge and odor. Choice B, interstitial cystitis. So interstitial cystitis, also referred to as a painful bladder syndrome, present with chronic pelvic pain, urinary urgency, and dyspareunia. This patient has no pain. Overflow incontinence. So overflow incontinence is due to a neurogenic bladder or outlet obstruction. Choice D, pelvic abscesses. So patient with pelvic abscesses present with fever and pelvic pain. Choice E, urethral diverticulum. So urethral diverticulum is a local outpouching of the urethra into the interior vaginal wall that present as a well circumscribed isolated cystic mass. Choice F, urethrocoel. So urethrocoel is a urethral prolapses into the vagina due to the loss of ligamentous support. Choice G, vaginal cuff dehiscence. So vaginal cuff dehiscence, for example, vaginal wound separation, is a rare but serious post-operative complication after hysterectomy.